Good afternoon, everyone. Thank you for joining us on this fourth part of the Writing Health Disparities Research Grants with Dr. Pasek. Just have a couple of reminders for everyone. Please feel free to add your questions on the question box at any time. We'll read those at the end of the webinar, the last few minutes, and then Dr. Pasek will be able to provide her responses. And then please, after the webinar, you'll receive a survey. We'd really appreciate it if you can complete it and provide us with your feedback so that we can improve on these surveys or webinars, as well as provide topics that you're interested in. So with that, I'm going to go ahead and quickly introduce Dr. Pasek, since most of you already know her. Dr. Pasek is a professor at UCSF School of Medicine, actually recently retired, but she's more than 25 years. She's conducted research, training, and community engagement to reduce cancer disparities among underserved populations of the San Francisco Bay Area and beyond. Her current research addresses breast and prostate cancer disparities by developing and testing communication strategies that would improve patient outcomes. She obtained her doctorate in public health from the University of California at Berkeley. So again, thank you, Dr. Pasek, for doing this for us. And so with that, I'm going to let her take over.
Hello, everyone. It's a pleasure to be back with you again for this, our last in the series of webinars on grant writing. I want to just give you a few updates before we launch in. First, there will be APHA alumni gathering for ExIDO and MTP-CCR alums. As always, we will try to keep these going as long as we possibly can. It's great to reconnect with everyone at APHA, and that is always Sunday night at 8 p.m. So we'll get word out to you about the location, but if you're going to APHA, please pencil in your MTP-CCR ExIDO alumni gathering. Second, I just want to let you know, for those who were not aware, that the MTP-CCR grant ended on August 31st after 20 years. ExIDO continues for 2 more cycles, so Areli and Dr. Ramirez will be continuing to have, excuse me, 2 more cohorts. I'm sorry, I want to let you know I have a cold, and I'm going to be muddling through in that sense today. Okay, continuing on, I'm confident I won't lose my voice. And I just want to note that even though the MTP-CCR grant is now over, we still will have a doctoral application support award for MTP alums this year. The announcement will go out in October. That will be our last of those opportunities, and it's for MTP people who are in the act of applying to doctoral programs. But please know that long after these grants end, Doctors Kagawa, Singer, Ramirez, and I are continuing to search for ways to keep this model going. We know this is a model for training that works, and we have sent over 200 people of color onto doctoral programs in our 20 years so far. And more of you are still on your way, and we are here to support you. So as Areli mentioned, I retired on July 1st, but that has no bearing on you or my relationship with this program. I will fight tirelessly to find ways to regenerate it. But the reason that I retired is because I've had the opportunity to pass the baton to someone I have the highest regard for. Dr. Kim Rhodes will take over my leadership role at the UCSF Cancer Center as director for the Office of Community Engagement. You should watch for her. She is going to be an international leader in cancer disparities. She is a rock star, and I am living my dream by being able to turn over my community work to her very capable hands and her passion and her knowledge and insight. So all is good. I'm still here. I'm still working full time, but there's a new director for the UCSF Office of Community Engagement. Okay, so let's go on with our final in our webinar series. Just to recap for you, and for those of you who have missed any of the previous webinars, please know that you can go on the Exito website and find the archived versions of the first 3 webinars. And again, I want to just reiterate that what I'm doing here is not Grant Writing 101. You should have many opportunities to take classes and all kinds of ways of learning about grant writing in the traditional sense. What this webinar series is about is my sharing 30 years, not 25 really, but 30 years of research experience writing NIH grants. And there's a lot more to it than you usually get out of the typical grant writing workshops. So I'm trying to share my insights with you the way I would with any of my mentees. And I consider all of you my mentees. So these are my thoughts, my insights, my tips that are not necessarily covered by other types of grant writing training. So we've gone through developing the overarching concepts for the grant, your research question, the scope of the study, and integration of grant components. And today's session is really going to go into a little more depth on integration. That's a major theme here for our session. We did go into some detail in some of the grant components, pilot data, the specific aims page, the all-important specific aims page, significance, and so on, as you can see. And finally, today, we're going to talk about the nuts and bolts. This is things like project organization, the timeline, budget justification, and human subjects. And again, just a reminder that you're welcome to put questions in the thingy where you can enter questions, and they can pertain to anything that we've covered in this series, and I'll try to save time to answer them. Okay, so again, this just reviews some of the things that we've already talked about. I tried to help you get inside the reviewer's head and give them what they're looking for. In the second webinar, we talked about the scope of the study. Young researchers tend to try to bite off more than they can chew, and I'm trying to help you not do that. And you see the interlocking gears. That is one of the things that you have to, if you do nothing else, keep that image in your mind when you're writing your grant and all the different sections, because it must be just like that. Everything depends on everything else. And Again, this was the last webinar where I said that by the end of the significance section, that's very early in the grant. It's really soon, right after the specific aims page. The reviewers should be, and I visualize this when I'm writing this. I want the reviewer to have a broad understanding of everything I'm planning, and I want them to feel that me and my team, we're the best people for the job. The problem we're addressing is compelling, and the methods we're proposing are the best way to do it. So there's the reviewer at the end of the significance section begging you to please go forward with this research. I think those kinds of mental supports are very helpful when it comes to getting through grant writing. Okay, so nuts and bolts. We're going to be talking about some aspects of the methods, the budget, human subjects, and other of the sort of more cut and dry elements of the proposal. First and foremost, again, this interlocking parts concept. Each and every action that is referenced in the methods section must be consistent with the conceptual framework and be matched to skills, effort, and the personnel time on the part of your co-investigators and staff, and all relevant costs. So when a reviewer is reviewing a grant, they should be flipping back and forth between the biosketch, budget justification, and the budget. Because when I see that you are proposing something, I want to know who on your team has the appropriate skills. You as the PI do not need to have all the skills, but you must have a team member, and they must have enough effort designated to the study. So in a large complex study, for example, your statistician that has, let's say it's a cohort with 3 different waves of data collection and complex analysis, you must have a senior statistician, and they can't have just 5% time on the grant. I want to see that every base is covered with expertise and adequate time. Now, you don't have to put the statistician in for 20% every single year. You can vary that, and really, technically you should when you have a few years in the middle where the intervention is kind of rolling along, although it never just works that way. You could reduce the statistician's time, and you could have them more in the first year. That's really critical. And of course, in the final year when all the analyses will be done. Reviewers really appreciate when people's time is adjusted according to their responsibilities by year. However, that makes life difficult for your colleagues because people need to count on a certain level of support. So this is something that you need to negotiate with individuals. But and I'll often try to work this out after the fact. So what I mean by that is I'll put into the budget what I think is really going to be appropriate in the reviewer's eyes. And then once the grant is funded, I'll shift things around a little bit if necessary. That is perfectly legitimate with a grant. You can't do it with a contract, but you can do it with a grant. And just as a little secret, you can kind of, you should expect that your budget, first of all, will be cut by the NIH by some level. And so ways that you can guard against that is, for example, putting in someone's time at a higher level than they would actually need. It's okay, I'm retired. I can say this, I won't be writing any more grants. And I'm sure that the funders know we do this, but these are things you need to think about when you're writing your budget. Another thing I'd like to mention is the different styles I've observed when it comes to approaching the whole grant. I talked about this in an earlier webinar, but I think it's worth repeating today with the material we're going to be covering. I tend to write a grant sort of from the heart, a little bit more from the brain initially, because I'm addressing a problem I'm passionate about, and I'm trying to think of all the ways I need to work on that. And I'm thinking about the specific aims, and I'm thinking about the methods, and I'm thinking about the team, but I am not thinking about the budget in the early stages, or even at my own peril by the middle of the grant writing process. I don't like working on the budget. On the other hand, I have a colleague who starts with the budget. She thinks generally about what the methods should be and who's going to be needed, and she starts to map out what it's going to cost, and that will drive her approach to developing the rest of the grant. I, on the other hand, will get to the point where I have to start thinking about the budget, and I will discover that my costs are too high, that I'm exceeding the limit. And so I have to kind of backstep. I can't really do it any other way. Whatever your way is, be aware of what you're giving up and what you're gaining. I feel I do my best work on the front end of the grant when I'm really focused on it and letting it all come out in a kind of emotional way. And so I later pay the price and have to backtrack. But it has worked out okay in every single instance where I've been a PI on a grant. So I put myself through agony, but it has worked out in the end. So know yourself, know what's going to make you comfortable, and know where your strengths are. And again, it all has to fit. So if you find down the road that you need to make cuts in the budget, you must go back to every single section and see where that has an impact and adjust accordingly. Okay, every dollar in the budget should be associated with text in the methods section and explained in the budget justification. You cannot be too detailed in that sense, because again, a good reviewer should be flipping back and forth between the budget justification, the bio sketches, and the methods section of the grant. Every point in the justification should have budget and methods counterparts. So what you're hearing is redundancy is not just okay, it's essential. Everything has to match up and make sense. Most everything that touches or involves participants should be included in the human subjects section. I'm not going into depth today on human subjects. I think that's something that is usually covered. And I'm only talking about it here because, again, it is a place where reviewers can turn to get a simple, straightforward picture of everything you're going to be doing in that. And very often there are some details that are in the human subject section that you didn't have room for in the methods. Now, you can't introduce a whole new survey in the human subject section, but you can elaborate a little bit in ways that you couldn't in methods. Don't leave anything important that reviewers should know to the human subject section. They may not read that very thoroughly at all. And so, nor can you leave it to the budget justification. Those you should think of. I mean, human subjects is essential. It has to be complete, comprehensive, because there are reviewers who will go through it with a fine-tooth comb and they will ding you if you are not following appropriate protocol or you're leaving something out. But don't assume that a reviewer will pick up something there that you didn't have room for in the method. So if it's important, it has to go in the body of the grant. Okay. And again, I will emphasize that you need to integrate theory throughout. I have seen proposals where the conceptual framework very dutifully follows the background or just immediately precedes the methods, or it's the first part of the methods, and it may be a paragraph or two, and that's it. It's just sort of this little island in the sea of the rest of the proposal. That is not okay. The concepts in your framework should be operationalized as variables in your measures if you're doing a quantitative study, and they should inform intervention elements and the way those elements relate to one another, and they should also inform the analysis plan. There really isn't any part of a grant proposal that can exist in isolation from all the others. And again, remember, as far as the conceptual framework goes, and I believe you can go back to webinar 2 perhaps for more detail on this, it's okay to blend elements from different theories in your conceptual framework, because it's relatively rare to find one theory that works for everything you want to do. So it's as long as you justify and say, I will say I'm drawing on X and Y theories because these constructs are most germane to the proposed research. I'm not so vague as that, but as long as you explain it and it makes sense, you can be creative and you should not feel constrained. Okay, so I developed this table just once again for further emphasis on the integration and to give you some detail, detail for how things should fit together. So let's start with the top row. If you are using one or more surveys, as I mentioned, the variables, this is how it should relate to the conceptual framework. Variables should operationalize the constructs and you should be measuring them. Perhaps you have a hypothesis in that regard that you'll be seeking to test, or you may not have a hypothesis in a more hypothesis generating study. As far as the budget and budget justification, related to your survey, you need personnel. And when I say personnel, I mean skills who can do the work of developing, translating if you're using multiple languages, implementation, and analysis. All of those skills and actions must be recognized by you, both in terms of allowing not just showing how you're going to develop the survey. That's critical, of course. You must show that you know how to do that. And it may be from using items already validated in other research, or you may need to adapt your own. You should have a systematic process for that and for pre-testing. Pre-testing is another thing that should be in here in this parenthetic list. You need time in the timeline, and you need people with skills, and you need money with in the budget for every single thing related to the survey. If this is going to be a paper and pencil survey, you need to have printing costs, you need to have data entry, or if it's a tablet or web-based, you need to have costs and time devoted to development of the web. And very importantly, you need to have participant incentive, financial, gift card, whatever you use, incentives. So this is how the budget and budget justification are critical in terms of the survey and vice versa. There's another section that I always try to show at the end of my methods called project organization. And this is one of the things where if I have room, I will add a brief paragraph that starts out by saying Dr. So-and-so will have oversight for all the collaborations and achievement of the specific aims. That's the PI. And then she will supervise X number of people, and that they will oversee A, B, and C. So you want to be able to very briefly explain not just what the individuals will be doing, but how they relate to the whole and to the achievement of the specific aims. And then I have a little trouble with, oops, no. Sorry, I'm trying to see the far right side of this table. So your timeline has to be realistic. And as I said, there needs to be time devoted for every task. And I'll show you before we close today a graphic timeline as an example of how I show these things. But again, you can see how the survey and all of its aspects relate to other parts of the grant. Similarly, for the intervention, if you have an intervention that you're either developing or testing or both, you want to be able to show how it's derived from the conceptual framework and the impact, the theorized impact of the intervention. Again, all possible costs need to be thought through very carefully. This is where I've emphasized this previously in other webinars. You want other people's input to your grant. It's really a pain to have it reviewed by people because everybody wants you to do something different. But even if you don't follow through on all the suggestions, and you rarely can do that, you will get somebody saying, oh, you need to, you've left out a critical aspect of the intervention that's going to add considerable costs to your budget. You need to think about that now. So get input because you can't always think about all these things. Also, here, I will bring up for community-based participatory studies. Of course, your community partners need to be included throughout in terms of decision-making. Their time needs to be compensated. If you are working with organizations and they're central to the intervention, there must be some form of payment to them. I'm working on an R01 right now with 3 public hospitals, and I recognize that some of their staff, I've gone to extreme lengths to minimize the need for anybody's time within those systems, but a little bit of staff time is necessary. And so we are making sure that they have some funds. And here's another thing that is a little tricky, but I tell them you can use these funds however you want. I'm just wanting to make sure you are compensated in some way, because it's not always easy in a public hospital to funnel funds to a frontline clerk who's passing out, a survey or something like that. And you, again, don't want to make life any more difficult than it has to be for people and organizations like that. And yet, there must be money that flows. And sometimes a lot of it flows to a community organization if they are shouldering a lot of the load. And then you have to have a subcontract. And that's another document where you can kind of show what, say you don't have page limits in a subcontract, so you can help your partner writing the subcontract and the scope of work, and you can amplify it a little bit and make sure that it covers all the bases, and use it as an opportunity again to show that you're thinking through all of the parts and that everything is well connected. So I guess a summary statement would be pertaining to that there are a few documents that have no page length. One, no page length limitation. One is budget justification, another is letters of support, human subjects, subcontracts. These are places where you can be a little more expansive and add in some things that you'd like reviewers to know. But at minimum, they must interdigitate perfectly with everything else in the grant. So when you are working with someone on a subcontract, make sure you see it, you have input to it. Sometimes they want you to write it if it's a community organization. Help them think through the costs that they're going to incur so that to the reviewer's eye, it makes sense. Don't claim to be doing a CBPR study if there isn't a fair amount of the budget going to community partners. Okay, so as you can see, I've taken the intervention across the conceptual framework and so forth. Similarly with qualitative research, you want to be sure to include costs for transcription, and if transcripts are going to be translated from any other language, that's a pretty significant cost. All of this you need to nail down ahead of time. Usually you should have colleagues in your institution who can tell you their experience with these costs and with contractors. You don't necessarily have to state a specific contractor at the time you're writing your grant. You can just show what you estimate the cost to be. But reviewers who have done similar work are going to know if you're way out of line or not. Make sure you have ample funds for every part of your methods. Okay, and Once again, change in one element is likely to affect all the others. So you need to go back and forth, and you need to frequently be reading through all the parts kind of in one sitting so you can keep it all in your head. And importantly, this is really something that people just somehow don't pay attention to, regrettably. Keep the terminology identical throughout. Don't have lay health workers in one section and community health outreach workers in another section. This applies to everything. Whatever terminology you choose, use it the same way in every section. Okay, so here's an example of a graphic that I have used, and this was an R01 grant for the timeline. And this requires judgment and experience and input from others, because in my experience, even here, yes, even in the 30th year of my research career, I underestimated how long it would take to do the developmental work for my current R01 grant. And it actually ran into the second year by quite a bit. So we're having to scrunch up everything else. You want to be realistic, and you want reviewers to feel comfortable with what you've proposed. I have many times in reviewing a grant looked at the timeline and said, no way can that work be done in this short a time. So you really want to be, you must be, for your own sanity, you need to be realistic. So you can see in this study, I did allow for the design, production, translation, pre-testing of protocols, materials, and surveys to take a full year and a half. And believe me, on that study, it took longer. And above, I have a very short narrative that sums it all up. Development of the recruitment scripts, et cetera, during the first 18 months. Recruitment will begin in month 19, and so forth. So that's a really, if you are just unable to get another line into your grant and you can't do the graphic, you can just do that narrative. It would be better if it was a little longer if you're only using text, but at the very least, give the reviewer a few sentences to map out how you see this all unfolding. In addition, you can also, when you are detailing your methods in the methods section, you can repeat some of this information. In year one, we will do X. Sorry about that. In year two, we will do Y, and so forth. So some repetition of these kinds of issues. Now, I have very briefly summarized the key actions that we're going to be taking in the methods section going down the first column here. Design, recruit and train telephone counselors and interviewers. That always takes time. One can't assume that you're going to have staff ready to jump on things. The other thing that's actually missing here is IRB approval. In some places, that can really take a lot of time, and reviewers would appreciate seeing that you've allocated time for that. So here are all the elements going down to the right papers and final reports. But I have to confess yet again, it really depends on the team. When I have a senior sort of project director, a PhD level project director, those have been grants where I actually do get papers written while the grant is still funded. But for many others, I'm still writing those papers after all the money is gone, and I don't recommend that. Believe me, I don't recommend that. That can really be a weight that you carry on your shoulders. I'm carrying it right into retirement. I'm going to be writing, catching up on some of that writing. So if you can see your way through to do it, start writing as early as possible. And, you know, your grant should be written in such a way, should be written so beautifully that you could use that as a basis for the first paper. If at all possible, write a paper about the conceptualization and the development of the study so that people are watching for your outcomes some years later. But that's a different topic. Okay, the budget justification, and I'm going to try to wrap up very shortly so that I can get to your questions. Please do enter your questions. I mentioned that there's no page length for a budget justification. So what you see here is, first of all, sometimes I have things I want to say to reviewers about the budget. And I will simply make a note at the start of the justification. It could pertain to how different things are funded. Very often, when you have subcontracts, for example, reading through the budget justification for the prime award, the parent of the parent institution, if you will, it doesn't paint a full picture. So I'll do a note at the top to explain where the different subcontracts fit in to the overall budget. Here I say that each of the 3 study sites has a unique relationship with UCSF. So this is the grant I'm doing now, where I'm working with 3 public hospitals. One of them is closely joined with UCSF. So there is no subcontract for that hospital, but there is a subcontract for the other 2. The other thing I want to illustrate here is that I see a lot of grants where people just write, when they're describing personnel, they'll just say, this is what so-and-so is going to do. A few sentences about that individual. But I take a different approach. I write about each person in a narrative here, including the things about their experience that are relevant to this grant and to the role they're going to have. And then I end with what their role is. Dr. Pasick will have primary responsibility, blah, blah, blah. And before that is a summary of the experience that prepares me for that role. You know, again, some reviewers won't even look at that, but others will. I do, because I really need to have the dots connected for me. I don't like having to piece things together. That's a lot of mental effort when you've got, you know, 6 R01s to review. So I appreciate having all of this laid out for me. And this particular budget justification was 7 pages long. That's more than half as long as the narrative of the grant itself. So I'm taking advantage of this opportunity to explicate a little more of the strengths of our research team and also to show I really understand all the costs that I'm spending and how they relate to one another. Just a couple other notes about budget justification. The NIH has really tightened up on things like supplies, things like office folders and papers and pens can no longer be charged to a grant unless they are detailed in the budget justification. And so if you can, if there are things that you are going to use only for your study, you should break them out and describe them in this way. For example, office, and use this terminology, which I can't see in its entirety, although you can. Office supplies are required in excess of those needed in usual day-to-day operations. These include, but are not limited to, folders for transcripts. So in a qualitative study, you'll have thousands of pages of transcripts. You're gonna need filing cabinets and stuff like that. Think through, try. It's really hard when you're early in your career, but ask a more seasoned person to take a look at this as well. What are expenses I'm going to need? I want to think of them ahead of time, and then will have less of a pushback when it comes to getting reimbursed or charging these things to the grant. And more importantly, well, not more, but equally important, food. If you are working with communities, you have to have food. You can't have meetings with community members and leaders without food. And so I say in my budget justification, community partnerships require that food is offered at any gathering. And then I will detail, monthly meetings, food will cost $300 a meeting. If it's in the budget justification and the reviewers approve it, you can spend the money that way. And if it's not, it's coming out of your own pocket, or if you should be so lucky as to have a discretionary fund. Do ask for discretionary money, because ask your department head for discretionary money, because there are many costs associated with our grants that are not always covered, or we didn't think about it soon enough. Travel expenses, mileage, that's another thing. Bridge tolls, those things all mount up. You need to reimburse your staff. I don't ever want people taking money out of their own pockets to pay for the work that we're doing. So I am either going to pay for it out of my pocket, or I'm going to have it covered in the grant. So again, detailed, close your eyes and imagine every phase of the study and what everybody's going to do and what the costs involved are. Okay, last few words about style. I'm really big on this. I like to keep the text clean. I do not like grants where they have a lot of bolding, capitals, and underlining. I feel like I'm being shouted at. So if you want to emphasize something, and I urge you to emphasize your key points by putting them in a text box. Otherwise, keep the text very clean. Look how approachable that page is. I don't have a whole lot of white space, but I have some. And for a challenged reader like myself, I appreciate a page that's more inviting like that. That's the text box is close up. So lastly, err on the side of maniacal proofreading. You just don't want to have sloppy mistakes. That chips away at the confidence the reviewers have in you. Liberally cross-reference among your sections of the grants. Grant repetition is key. Anticipate and state the limitations of your study, but don't get carried away. You know, there's a fine line that people sometimes cross by there. I can't go into this in any depth here, but definitely state limitations. You don't have to air all your dirty laundry though. Co-investigators need prodding. Don't let them wait until the last minute to submit their bio sketch, to write their sections. They should write sections of the grant that pertain to their areas of expertise. Don't let them, it really can screw up your whole grant writing process if they submit something late that doesn't really fit. Start on letters of support very early. One of the first things you should do is draft an abstract as close as you can get it so you can send it to people who are going to be submitting letters of support. So that is it, my final words. A proposal is never finished. It just has to end when you press send. I hope these webinars have been helpful to you all, and I hope you have some questions. Any questions come to you?
Not yet. So if anyone has any questions, please go ahead and type them on the question section and I will read them.
I also will take this time to say that I've said very often that I am here for you guys, and I mean it. If you're developing a proposal and you want to bounce some ideas off of me, or you really have a challenging question and or something you don't feel comfortable asking your mentor, or they don't, whatever, really drop me a line, pick up the phone and call. Make sure you put in the subject line MTPCCR or EXITO, so I hopefully won't let it just slip below the line into the abyss, the email abyss. But I'm not going away. I've retired, but that's really invisible to almost everybody. So take advantage of me and my devotion to you, because I do very much want to see you be successful. And please keep your information coming when you get into a doctoral program or you get your first grant. All of that is more justification for continuation of this program. And we'll continue to collect it as long as I'm around. So definitely stay in touch. Let us know of your accomplishments. So, no questions.
No questions yet. Just someone wanted to say that these webinars are great and they want to thank you.
Oh, that's great. Thank you. Well, whoever wrote that, get in touch. I'm here. I love you all. I wish you the very, very best. You deserve the best. You are so important to the work that we're doing. It's been my honor and privilege to be able to help you in any way. Take care. Hope to see you at APHA.
Okay, thank you, Dr. Pasek. Just want to remind everyone that we do upload these on our website at exitotraining.org. That usually includes the recording and then her PowerPoint slides as well. And also right after the webinar, you'll receive our survey. So please encourage you to complete it so that we can get your feedback. So thank you. Thank you for joining us. Have a great rest of the day.